Today on the show, I have with me by Zoom Dr. Patti Giebink. Welcome, Dr. Patti.
Thank you, Renee. Glad to be here.
Thank you so much. So, Dr. Patti is a board certified OBGYN physician who, over the last how many years, she'll tell us that, but has
30 plus.
over 30 years of delivering babies and working with women in pregnancy and health, all kinds of things. The reason we have Dr. Patti with us today is because she, for a certain number of years, was a doctor for Planned Parenthood and had a major change in her life and stopped doing that work and became a pro-life advocate. So there's some huge changes that happened in here. And we wanted to, Dr. Patti does this kind of work a lot. She wrote a book recently. I don't know if Casey can get that. It's called Unexpected Choice. I'm in the process of reading this now. I've read probably a good half of it, skipped around a little bit, but it's got some really compelling things in there, some really great information. So we wanted to have Dr. Patti come on and tell us her story, tell us what she knows as a doctor on both sides of this conversation, so we can kind of talk intelligently about what we're looking at here, especially as we come to our election year. So Dr. Patti, will you start first by just tell us a little bit about yourself, what you're doing right now, where you grew up, whatever you want to tell us.
Thanks, Renee. I grew up in Sioux Falls, the middle child of 7. My dad was an orthopedic surgeon, and a number of us have gone into medicine. I didn't go into medicine until I was in my 30s. So I had a couple of careers before that. But I ended up in medicine and wasn't initially going to go into OBGYN, but got interested in women's health. Then as I was in medical school and we were sort of honing down what we wanted to go into, I realized that I really liked doing OBGYN.
Mm-hmm.
And in the latter years of practicing, I did almost exclusively obstetrics because that's really my passion. And I've had the privilege of working overseas in other countries, Pakistan and the Middle East. And it's given me a broader vision of healthcare and a bigger appreciation of what we have here in the United States.
Yeah, I bet it really has, seeing what, especially women, but just what healthcare is like in different countries and what's available. I understand that a lot of countries are not as behind as we might think as Americans, I think, and others are.
Yeah. We have a lot of resources that we are very privileged.
Yeah.
And we take it for granted a lot.
Yeah, for sure. Okay, so I know that as you were going through your residency, you decided to go into obstetrics and gynecology. How did you start your work with Planned Parenthood kind of right away, or was that something that happened over time?
No, I went to the University of Indiana, IU Med Center, for my residency, and it's one of the places that trains OBs in abortions. I really didn't pick it for that, and back when I was applying for residencies, it wasn't really a topic that was mentioned. But I ended up going to Indiana and working it was called the Well Women's Clinic. It was never my plan to be an abortion doctor. That was never my plan. But I had been practicing in Sioux Falls for a while and split off on my own and had my own private practice and was approached by Planned Parenthood to work at Planned Parenthood part-time. So I was still delivering babies and had a very active OBGYN practice, which I loved. And then so at that time, it was almost 2 years. And I only, like, I'd go over to Planned Parenthood one day a week and do abortions.
Mm-hmm.
And the rest of the time, I was taking care of my patients,
Right.
which now it seems kind of um, like too big of a contrast where I'm delivering babies and that's not an easy job all the time, and there's constantly making decisions about when to do what. And then one day a week I would go and do abortions, and now it just seems like I should have had some type of conflict with that, but at the time I didn't.
Mm-hmm.
But then the only abortion doctor, Dr. Buck Williams, wanted to retire, so his exit strategy was to have Planned Parenthood hire me full time.
Sure.
And if I could have one do over,
Uh-huh.
I would say no
Yeah.
and keep my practice.
Yeah. Because
Um,
you loved
I
it.
so I closed my practice and went to work for Planned Parenthood full time, which wasn't doing any more abortions. It was doing more just basic GYN and more ultrasounds and um, birth control and stuff like that. And after it was exactly 1 year later, we split ways. And even though you don't have to tell people why you're actually, I got fired, which was a relief.
Yeah.
It was a real battle. It was my way of practicing medicine and my ethics were not their ethics.
Sure.
I don't like breaking the law, especially when I don't realize I'm breaking the law and I'm only doing it because somebody else dropped the ball. And having no protection, um, discovering that Planned Parenthood, who I used to think was a really good organization, has no appreciation for the law. And anyway, so they fired me, and I felt great relief, and went on and started doing a lot of call coverage.
Okay.
And that's how I ended up in Chamberlain,
Oh,
because
sure.
I came out here to cover for the OB who was on vacation, and ended up coming out here and working. So, and that I did. I've worked in a number of rural hospitals in South Dakota, and maybe not so rural. I've worked many of the places covering OB. Um, and I did that until I wrote my book. And then my book came out, and it was right around the time of COVID. So um, I just kind of thought maybe I should retire, and work, put put my talents towards preserving life.
Yeah. Yeah. So you said that it was a relief when you were fired. Do you think if you hadn't been fired, you would have eventually been like, I don't know if I can, especially because the ethics part was just not driving for you. Because of course
Yeah.
that's really the only place in South Dakota that you could do abortions, right? Was with Planned Parenthood.
At the time,
Yeah.
yes. Yes.
So do you think you would have left relatively soon anyway? Was there already a change happening for you?
Oh, the year was brutal.
Yeah.
It was one of the worst years of my life. Um, because I wasn't, the doctor, I was not, they would not let me be involved in anything other than doing procedures.
Right.
No counseling, no, uh, everything was determined by the big Planned Parenthood, and all their policies and procedures were in this big binder. Um, and it was not a good place to work.
Right.
So, but I probably persevere too hard in things. It seems like every job I've left, I have the feeling I should have left sooner,
Sure. Sure.
but I
Well,
don't want to give up.
yeah. Yeah. Um, okay. So while you were there and in the work you did, what did you see? Like, what was abortion really like for women? What does it do to them? emotionally, physically? Like, what was your experience with that?
A lot of the stories that I heard in my room would break your heart. Um, and that's partly why I wanted to write a book so that people could have a better understanding of both sides.
Right.
I would say that most women who came and had an abortion knew what they were doing. And many women, it broke their heart as well. And if they had other choices, they wouldn't have done what they did. Um, and so I think that as a pro-life person, I try and help women see other options, to see that, this, there will be an end to this,
Mm-hmm.
that they don't have to do something that they might regret later.
Right.
Um, and I think especially this year where we have everything to lose.
Mm-hmm.
It was easier under Roe.
Yeah.
Definitely easier. And I get a little passionate talking about this because if we can't speak the truth in love, we're going to lose. This amendment is too extreme. It's extreme, and it does not provide for any protections for women. So these pro-choice slash pro-abortion people are talking about women's rights, and yet this amendment takes away all those rights. It says there can be no regulations in the first trimester, which means no true informed consent, no standards for clinics doing abortions, no parental rights. I mean, it just strips away all these protections for women. There's a lot of people on the fence who don't really understand. So I try and ask questions.
Yeah.
Um, why are you for abortion? And then based on what they say, I kind of try and send it back to them and say, I had one person talking about bodily autonomy. I said, what do you mean by that? What do you mean by that? Um, I think that most people who call themselves pro-choice and are going to vote yes on G are naive, even to the point of being ignorant about what this really says. I have a number of people in my family who signed the petition and are probably going to vote yes.
Oh
And
gosh.
I'm like, oh my gosh, if they knew, I mean, it is too extreme. This is South Dakota.
Right.
New York and California, if they want to be really liberal and, have these very liberal laws, fine. The other thing is we need to know the truth
Yes.
and speak truth. And that's why I wrote that one article in the Dakota Scout
Yes.
recently, is I wanted to combat the lies that they're saying.
Yeah, can you tell
And
us
I
a
know
little bit
that,
about that article? I was going to say that was a really good article explaining what actually can be done as far as any health problems that come up during pregnancy.
yeah, yeah. This past February, I testified in Peer on a piece of legislation, and there was confusion. And I said, if you go back to the South Dakota law, which not many people do, and it says the intent, and I'm going to put in elective, the intent of an elective abortion is to end the life of a separate, unique human being. That's the intent.
Mm-hmm.
Now, what is the intent when you're taking care of a pregnant woman? My goal is to have a healthy mother and a healthy baby.
Mm-hmm.
And it's a balance. And that's, to me, that's the excitement of doing obstetrics. That's what, gets me out of bed in the middle of the night is, weighing these things, is the baby ready? What's the mother's blood pressure? And, what do I need to do?
Right.
Because that's where the art of medicine comes in. You have your training, you have your experience, and then you work through the problem.
Mm-hmm.
So we always try and get the baby to the point of viability, which it's amazing in the United States how well we do with these tiny little babies.
Mm-hmm.
Um, we get the pregnancy to the point where the baby can be born and has a good chance of survival, but we don't compromise the mom's health.
Right.
We don't take them to the point where the mom is going to deteriorate. So it's that fine line, and that's why you want to go to a doctor who knows what they're doing and has experience. So my intent is not to end the life of that unborn child, that baby, that fetal human being. My goal is to get if I have to deliver the baby early, it's an early delivery. It is not an intentional abortion to end the life of that baby.
Right.
So everything else comes from there. It's like a decision tree. Um, and that's why we go to medical school and residency, is we learn how to balance these things. So sometimes if, in some severe cases, the baby doesn't survive. And that's a tragedy, and it breaks my heart. And we deal with that. But that loss is far different than the regret that women have when they intentionally choose abortion.
Right. And I think that's where a lot of times people get kind of tripped up is they think there are all these different scenarios health wise that require an abortion, but that just really isn't the case. I mean, is there really ever a time when you have to say we're going to have to go in and abort the baby, or this will happen? It's really a little more nuanced than that.
Right. There are situations that are hard,
Mm-hmm.
premature rupture of membranes.
Yeah.
But we have a, a sophisticated medical system where we can pick up infection before it becomes overwhelming. And those are the cases, premature rupture of membranes, those we have successfully brought those babies to term or near term, where they can be delivered.
Mm-hmm.
But that's not always the case. So again, it's a balance and monitoring the mother and the baby and deciding when that delivery needs to occur. But again, the intent is, according to South Dakota law, the intent is not to end the life of that baby.
Yeah.
And truthfully, I am bewildered by the confusion in the medical arena, where doctors are saying that they can't take care of these problems. And I'm like, no, of course you can. Now, it's one thing if you aren't trained
Mm-hmm.
to take care of these problems, then by all means, transfer the patient to somebody who has the training to take care of these problems. There's a few things that I haven't seen in pregnancy, but I've seen a whole lot of things. And, when we lose the baby, it's a tragedy.
Yeah.
There are some very, very, very rare conditions that we need to remember. These are extremely rare. And the decision for those is we're protecting the mom.
Right.
We're protecting the mom. And whenever possible, we also protect the baby. We try and do both, but there's some very, very rare conditions that really require doing things that may end the life of the baby.
Right. And we hate those, but they do happen.
Yeah.
Yeah.
Extremely rare. Extremely rare.
Right. And so we shouldn't fear, we only have about a minute left, Patti, but we shouldn't fear as women going to term even when things are difficult, because those things can be handled. And
Right.
in almost,
Right.
in nearly every case, if not every case. And
Right.
yes, sometimes, like you said, sometimes a baby might be lost, but it's not because you didn't try to
Right.
save them.
Right.
So, Dr. Patti, I really appreciate you coming in and telling us your story. There's a lot more that we could talk about. Dr. Patti is going to be on The Good Life with Chris Motes here in a future episode as well. So I'm sure she'll talk about some different things. So if you want to hear more about her story, about her thoughts on this topic, you can certainly check in with her there. Thank you so much for being here. I really, really appreciate it.
Thank you, Renee.
Yeah, you
I
bet.
appreciate it too. Thanks
Yeah.
for your time.
All right. If you want to learn more about Amendment G, about some of the myths and some of the facts around it, you can visit sfcatholic.org/respectlife. We have quite a bit of information there that can help clear up some of the mysteries and some of the myths that are surrounding that. And make sure you get there before November so you know how to vote and, of course, vote no. That is it for us today. Hope you'll join us again next week for more Catholic Views.